Imagine a world where we made all our decisions about what to buy based on cost. It'd be a really weird world. Like some of the most iconic products wouldn't exist. There wouldn't be an Apple iPhone, and there probably wouldn't be like a Ford Mustang. Those just wouldn't be there because they're not the cheapest product. Well, unfortunately, in healthcare, a lot of employers who are buying health insurance for employees are still making decisions solely based on cost. And today, in this episode of Healthcare Hacks, I want to talk to you about some other things to think about when you're making that decision about what health plan to offer to your employees. Hi, my name's John. I'm your healthcare hacker and a multidimensional purchaser. Before we get started today, please take a minute and follow Athos Health on your favorite social media platform. We're trying to get our message out to as many employers, employees, consumers as possible about ways to navigate the complex U.S. healthcare system, and by liking and following us, you help us do that. Over the next couple of healthcare hacks, I'm going to talk about what factors employers should use when deciding about what insurance to offer their employees. It seems like a pretty straightforward topic, but it's really actually pretty complex and pretty nuanced. As I mentioned in the beginning, a lot of places just use cost. They take last year's claims experience, they run it through some actuarial tables, and they say, okay, well, here's the lowest cost insurance you can get. Well, cost is important. There's a lot of other factors that go into that, and even ones related to cost. I want to talk about two today. The first one is what your employees are going to pay out of pocket. It's not just what their deductible and premium is, but it's also like what tools they can use to offset some of that cost. So for example, when I talk to an employer, I strongly recommend that they choose a plan that allows their employees to get an HSA. The reason why is the tax benefit, and it's also a great savings vehicle. I've done other healthcare hacks about HSAs for the employees, but if you can offer that to your employees and explain it well, and that's very key, as long as you can explain it well and how to use it, it can be a boon for them. You might be offering them, I'll say, what they seem to be a higher deductible plan and more out of pocket. But for many of your employees, especially young, healthier ones, if you have a lot of those, this can be a great way to lower their tax bill at the end of the year and also save towards retirement. The second thing is, if the cost is too low, I'd start asking questions. Why is this plan so different than others? Could be that it's a reference-based pricing plan, which, again, that's fine, but it can lead to some employee dissatisfaction because of balanced billing, some extra hoops they're going to have to jump through, and it may not be worth it. Or it might be something that's really narrow network. Again, not inherently bad, but just realize your employees may get more out of network. They're going to have to do some education about who is actually in network, and their doctor might not be, and you may hear about it. You know, my grandmother always said, if something seems too good to be true, it probably is. And that applies to health insurance. If you're getting a plan that's an outlier, it's much cheaper, I'd really start digging and ask some questions. Why? What's different? And how can they be so much cheaper? Well, those are two considerations beyond just the dollars and cents of a health plan. If you have any questions or comments about this episode, please leave them in the comments below. We'll get back to you either directly or maybe address them in a future episode of Healthcare Hacks. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.